Good afternoon. Welcome to today's Facebook Live. I'm Dave Olajars, Manager of Media Relations for Henry Ford Health System. Today's topic is mental health, and as we know, the COVID pandemic has had many of us feeling stressed out and anxious during these difficult times. It's important that we check our mental health and take steps to address any problems that could be arising. Today, we're going to be discussing what it will take for us to know when it's okay with our new normal. I'm pleased to have us joining us for today's discussion are Dr. Elizabeth Bulat, who is the Medical Director of Addiction at Henry Ford Maplegrove Center, as well as Dr. Philip Lanzisera, a Henry Ford psychologist who specializes in treating anxiety, depression, post-traumatic stress, and pain disorders. Dr. Bulat and Dr. Lanzisera, thanks very much for joining us.
Thank you for having us.
Thank you.
Quick reminder before we get rolling here, folks, make sure to turn your sound on and read our disclaimer at the top of this thread. And with that, we're going to get rolling. And Dr. Lanzisera, I'd like to begin the discussion with you. People can't say goodbye to their loved ones, as we know, due to hospital visitor restrictions. For others, bills are piling up at home. There's so much we can't control right now, right? How is the pandemic affecting our mental health?
Well, all of these things that you've mentioned will certainly be stresses for people, and those things will make it more likely that you'll experience some degree of distress, a little bit of anxiety, a little bit of depression, maybe not a little bit. Perhaps you won't be experiencing levels of distress that would require any mental health, but you're going to feel some distress. Now, others who are more vulnerable or already struggling with depression or anxiety, it could tip them over to a more clinical range. You know that we are social beings. We need contact. We need pleasant activities. We need meaningful activities. We need hope for the future. And those are the things that being isolated the way we are can cause us some difficulties. And if you're a person who's particularly afraid of this pandemic, thinking, oh my goodness, we'll never be back to normal, that can be a real blow to you, make things really tough. So I do think it's got an impact, but the impact will be very different for different people.
Are there certain signals that people should be watching out for?
Well, sure. Look, for any major change from your normal way of being, you know, you might find that you're not sleeping as well, or your appetite has changed, or you can't relax the way you used to relax, or you're not as interested in things, or you're so focused on one thing and you can't focus on other things in your life. These are all things that are telling us we're hitting our stress point, and we're developing some problems.
Dr. Bulat, I'd like to turn to you now. On the addiction side of things. There have been a number of reports about increased alcohol sales. Deliveries are up. As an addiction specialist, are you worried about people self-medicating?
Yeah, certainly. I think what we're seeing is, an increase in substance use and other types of behavioral and chemical dependencies. It's really important right now to embrace a healthy routine and keep the structure, and then maybe exercising, eating healthy. But what we're seeing is likely self-medicating. And so working on coping mechanisms that can be healthy and productive would be very essential right now. So when this does pass, we're able to get back into a healthy lifestyle.
Do you have a sense, Dr. Bulat, that more people are simply just drinking at home because all the bars and restaurants are closed?
Yeah, I would say, there's definitely likely an increase in consumption at home because of the isolation. But what I'm finding is that actually patients that are in recovery actually doing much better during this self-quarantine because they don't have access to some of the substances that were their drug of choice. So sort of a kind of a catch-22. For those folks that don't have a use disorder, we certainly want to embrace healthy coping mechanisms, like I said, exercising and focusing on hobbies and things to stay busy to deal with the stress that Dr. Lanzisera mentioned. But we want to make sure that we kind of continue this. So again, when this is over, we can get back to our normal lives.
Dr. Lanzisera, what are you hearing from your patients?
They're bored and restless. Very.
You know, are they feeling helpless? Is there some angst there? Are they afraid? What's your sense?
You know, we treat a lot of folks who are in the more vulnerable populations, the folks that have been getting sick with a little bit more frequency. And they're concerned about their families. Many of them are concerned about their ability to pay their bills. Some have no benefits. Some are losing insurance. Some people have been furloughed for the first time in their lives. They've worked consistently. They've had good jobs, even responsible jobs, and they've lost a job or furloughed, laid off for the first time in their lives. That's a big adjustment. They have to figure out what that means. You know, people who have been laid off before, been through it before, they sort of have figured out how to cope with it, or at least many of them have. But people who've never had it happen to them before, it's really a different thing. So we have people who are sick. We've had people who many people have had family members die because of this thing. And it is a stress. That's what we're hearing, all of those kinds of things.
Any pieces of advice for those folks who are going to be furloughed for the first time in their life? What are you telling these patients?
Well, if it's the first time in your life, spend some time to figure out what your next step is. Try to guesstimate, listening to what people are saying on the news and what the governor says and whatnot, how long it might be. Take a look at your resources. I mean, these are questions to ask a finance person, not me. I'm not the one to answer those questions. But you need to have a plan, how you're going to spend your time, what you're going to do. And that's true for anybody. You know, get a routine going, you know, go take walks. I saw a cartoon the other day of this dog sitting high up in the kitchen saying, "You've taken me for 20 walks already today, leave me alone." So we need a routine, and getting out, taking walks, taking care of things that you haven't done in a long time, that's what you need to do.
And certainly monitor, you know, be cognizant of you know, social distancing when you're out.
Oh, of course. And that's what makes it so difficult, because most of the things we like to do are not things that are 6 feet apart from other people.
I know on the behavioral health side for each of you, you're using virtual visits with your patients. How is that playing out for you guys as well as
really working well? Our patients don't seem to mind it. At least none has really said a lot about it. Some do want to get back into the clinic. They want a person-to-person visit, but a lot of people are just doing very well with this. And we have some technical problems. You know, video visits don't always work without interruption. Occasionally, a dog joins the visit for something or whatever. But generally, people are doing okay. There are a lot of the problems that we're having are largely getting things to and from patients who need something taken care of. That's a little bit tricky yet. We're figuring that out, but but the actual visit itself is working really pretty well.
And Dr. Bulat, what's your experience been like so far?
Yeah, I would echo the same thing. I think it's been an interesting perspective to see patients at their home and sort of kind of catch a glimpse of their reality. Patients have been very appreciative of the fact that we're so concerned about disrupting their care and having continuity. So it's been really a priority for the system and our department to make sure that we continue to see patients. But I've enjoyed it. I think we've had a very good, really low missed appointments. It is very convenient, obviously, but I think it's been really helpful.
Dr. Lanzisera, if someone thinks that their mental health is suffering, what would you advise them to do?
First, reach out to family and friends. That's always our first line. But if that's not enough, then call a provider. There's the ability to do virtual care. I'm so sorry. No. I forgot to shut it off. With virtual care these days, there's no good reason to put it off. We can get care, and I'm sure many other providers are doing that. From what I'm reading from the professional organizations, some people are moving more and more toward this anyway. And I don't know if community mental health is yet providing those services. And then there are lots of good helplines. There's a disaster distress hotline. There's a national suicide prevention hotline. There are substance abuse services. There are lots of virtual things anyway that one should use. And there are good apps about managing stress. And you can get those apps for your phone and use them. It's a wonderful thing, and I think we should use those things.
What about for frontline healthcare workers and first responders?
They need a break. They need to be able to go home and take care of things. They need to be able to talk to their coworkers. And even our team in our clinics, we meet every day in a virtual huddle for just a few minutes. Mm-hmm. Say hi, how are things going? Anybody got any problems? Just a brief check-in. And we all need that. And we're doing it virtually, and we're not on the front lines with all those folks who are very, very ill in the hospital. But they need to be able to talk to their friends, their family. They need to be able to talk to others. And then they need to know that when it's over, and this may be something that helps them get through that, when it's over, they'll have something to look back at with a real sense of pride and accomplishment. And they'll have wonderful stories to tell their grandchildren.
You sense, Dr. Lanzisera, that because of the fact that we have to keep a distance apart from each other, that plays into some of the emotional distress that folks are having? Not being able to,
especially if you live
with your family members and interact like we normally do.
I think it's hardest on the folks who live alone, because they don't have somebody in the house they can talk to. And, we're social creatures. We're not supposed to have to live alone. And so people who do live alone need to be able to get out and be with other people. And, they can't even go to the store.
Right.
Just to see other people. They can't do those things. So that's really tough on them.
What about parents? Any tips for them in terms of how to talk to their kids and what issues that they may be going through right now?
Well, it's interesting. My son has, both of my sons have young kids, and one of them was really very afraid because she heard about COVID right on the news and heard about people dying, and she had. Her dad had to sit down with her and say, "You're going to be okay. This is not an illness that typically hits little kids." She was an 8-year-old. No. Yeah, 8-year-old. And so we have to be reassuring to our kids. We have to structure their days. Kids don't. Some kids are great with little structure, but most kids need a certain amount of structure during their day. They need to know what's going on. I think it's really hard to talk to kids if a parent is very ill. That gets harder because you can't always be very reassuring that things will be okay. But you have to keep as optimistic and positive as possible without being a liar.
Dr. Bulat, how, and this is a question for both of you, how are each of you sort of coping with this situation right now, both from a professional perspective and then personally?
Yeah, so, I think it's been really a great thing, an opportunity for us to adopt the virtual care for Maplegrove and continue to that was a new kind of thing in terms of our care that we provide. And so there was a bit of a learning curve. It was sort of just exciting to be able to connect to patients. Personally, I've been fortunate enough that I have family at home, and so I've been able to connect that, have that support system for myself. I try to go outside and take walks when the sun's out and just stay active, also picking up different hobbies and things. So it's been, a unique opportunity for me to focus on my own self-care as a healthcare provider. And so that's been a good opportunity.
And I've been doing some virtual care for a while, on occasion in the clinic when it was helpful to a patient who otherwise wouldn't be able to get into the clinic. So I've done this before. So this is a pretty comfortable thing for me. Personally, it's really nice to get a little extra sleep in the morning because I don't have a commute. I'm wearing my slippers right now, which is really very comfortable. And I get to have lunch with my wife every day. I don't get to do that stuff. So, there's a way in which this feels very nice. I will say on a full day of patients, because the no-show rate is lower, it can be very tiring because you're very busy and you're trying to be on time for everybody, and that can be difficult. But apart from that, it's good work. It's rewarding work. And again, that half hour of sleep in the morning makes a difference. So, it's not bad for me, although I really miss my coworkers. I miss being able to walk down the hallway of the clinic and stop for a minute in their offices and check in to see how they're doing. Mm-hmm. That I miss, and talking to them online in the morning is great, but it's not the same as seeing people daily and socializing with them.
And how are the staffs holding up?
Not too bad. Some of them are stressed because they're alone. They live alone, and that's tough for them. But they seem to be able to do their work. They're all complaining about the technical glitches that they have. But, those are things we'll figure out over time.
Dr. Bulat, what should a person expect if they need to seek treatment for a substance abuse disorder? And then how are things different today than what they were, 6-7 weeks ago?
Yeah, so, as always, for those folks that are having physiological dependence, so we would say, likely having withdrawal and requiring detoxification, there is limited resources right now. And of course, the hospitals are very busy. So I would say, at a minimum, we always advise people to contact a medical professional and do anything under the care of a medical professional. But certainly we want to encourage folks to contact not only their primary care doctor, Maplegrove, there's various facilities in the area, and really begin to kind of explore what options they have. On the virtual side, we're able to provide outpatient detoxification to help with withdrawal symptoms, and also provide not only therapy, but medication-assisted treatment to help with craving. So we're still providing care. It's a little bit of a different way, but it's still available. And so the most important message is just to make sure that you contact a medical professional if you are having withdrawal symptoms or seeking care.
Are patients still able to receive medication-assisted treatment today, though?
Yes, and so that's something that we're doing with our virtual care. And so we're providing all of our outpatient services, like I mentioned, including therapy, as well as groups. But medication-assisted treatment is to help stabilize in partnership with the recovery program, to help limit cravings and things. And so we are still providing that.
In terms of social distancing, especially for those folks who go to AA and NA meetings, what should people do now for group interaction types of things?
Yeah, it's a great question. So, part of recovery, we teach people to avoid isolation. And so this is sort of an interesting situation we find ourselves in. But most meetings, 12-step meetings and mutual help groups are virtual now. The SAMHSA website, and I can reference that later again, as well as many websites have access to all of the resources online. But 12-step meetings, AA and NA, are continuing by format, way of Zoom or other types of virtual. So we're continuing to see patients, and I've heard very good things about them. So I'm happy that people are staying connected to their recovery support network and their sponsors during this time.
Dr. Bulat, who do you sense though is the most vulnerable right now? Is it someone who's new to addiction treatment, or is it somebody who's isolated perhaps from everyone? Give us a sense of that.
Yeah, so right now, what we're seeing is, and we kind of talked about this earlier, is those folks that are by themselves, I would say, is the most challenging. Again, we have virtual care, we have online meetings, but it still doesn't really compare to having someone in the home. And even pets, having pets in the house, I've heard patients say that's been very rewarding. But I would say the folks that are just getting into recovery, and specifically those that are going through withdrawal, I would say can be probably the most challenging if they're not able to connect to a medical provider, because there's just so many limited resources. So I would say those that are alone and those that are just getting into recovery, I'm happy to share that most of my patients that are stable in recovery are actually doing very well, and have not felt that the quarantine, other than creating maybe a little sense of vulnerability or disruption to their routine, they've been able to stay sober. So it's been very interesting.
This might sound counterintuitive, Dr. Bulat, but could somebody benefit from being sort of in this lockdown mode that we're in right now? Could there be some sort of forced withdrawal or abstinence in a situation like this?
Yeah, so much with the forced withdrawal piece, that sounds sort of punitive. I would never want someone to have to go through withdrawal without some sort of support, whether it's medication or therapy. But in terms of the continued abstinence, I think it could definitely be helpful if their surroundings typically are toxic to their recovery. This could be something that could be helpful. But again, we like to embrace, 12-step groups and online recovery. So I would still say for those folks to continue to connect virtually until this is passed over.
Any silver linings so far that you have observed on your front, Dr. Bulat?
Yeah, I think, what I've heard from patients, and I can speak to this myself, is just, sort of trying to make the best of the situation, focusing on self-care. I think it's caused everybody a reason to sort of pause, and I've seen many more families spending time together, just even, walking outside. For my patients, I'm hearing that they're homeschooling and they're spending time with their children. So, while this has been a healthcare crisis, I think on the other end, for those folks that were fortunate enough not to be affected directly, it's been an opportunity to sort of spend more time, quality time with family members. So that's been nice. And I think for me personally too, just the virtual care piece, I hope it's something we can adopt in the future, in cases of bad weather and things, to make sure that we do not disrupt the patient's care and appointments.
Dr. Lanzisera, do you anticipate there will be an increased need perhaps for behavioral health services in the coming months?
Well, as this continues, particularly if this continues much longer, and we have no way to know really how long this will continue, we will see people who, because they're they've lost their income, or because family, some people are getting closer. And then they're also predicting that there are going to be more divorces because people realize they can't get along. Mm-hmm. So we're probably going to see a lot of stresses of various kinds, and stresses always tend to increase the probability that a person will develop some kind of a psychiatric problem. Although that may not be the ultimate cause of the problem, it may be the triggering factor, the thing that puts a person in a situation where they can't manage the stress and their system begins to react in a negative way. So yeah, I do see some need in that sense. My concern, of course, is that the mental health system is already over capacity. We don't have enough providers now. So that's a real concern. Maybe we're going to be forced to think of new ways to help people. There are lots of good apps out there, and people are developing new ones all the time. So that might take some of the burden off if we professionals learn how to use them. And that's an if, because it's a big change for us. Mm-hmm. In many ways, perhaps more than it is for many patients. So that I do see a greater need down the road. I think that Dr. Bulat would probably agree that the risk here for development of substance abuse problems as people get more stressed, because often people fall into substance abuse problems because they're trying to self-medicate their anxiety or their depression. And then, of course, because they're vulnerable to substance abuse disorder, it takes over, and now they've got a double whammy. So I think there could be needs, increased needs on both sides.
We're closing in on the end of our Facebook Live here today. But before we do that, could I ask each of you to sort of offer some closing remarks from your respective positions, please? Dr. Lanzisera, please.
Well, first of all, please take care of yourself. Stay healthy. Keep your distance. Wash your hands. And get involved in things that you put off for a long time. Do something that, there's some project around your house that's been begging you to do. There's got to be. There's got to be something that you've always wanted to start doing that's not terribly difficult or complicated. Get in it. You might find you've found a new hobby. So do things that are meaningful, and keep contact with people. Use FaceTime or Skype or whatever is your video tool that you use most of the time. And keep contact with your family, especially the elder folks who are alone and need to be told constantly that they're loved and cared for. That's what I would suggest.
And Dr. Bulat?
Yeah, I would definitely echo the same thing in terms of, practicing social distancing and hand washing. I think specifically with substance use disorders, I think making sure that you're staying connected to your support systems, support networks, whether that's family, sponsors, make that a priority, as well as the online resources. So many folks, they go to meetings 3 times a week or daily. And so making sure that we stay in line with that. Also, I think being mindful for new thoughts or triggers. So even for those folks that are in stabilized recovery, they may find that the isolation or the concern about financials, et cetera, may be a new trigger. So I think identifying that and being open about it. You mentioned earlier embracing new structures and new routines, journaling, exercising, picking up an instrument you might have started to play years ago. And then I think at the end of the day, knowing that this will pass, and only sort of, kind of mindfulness of the fact that this is something that we don't have complete control over, but trying to just, take one day at a time, as we say in recovery. And then lastly, if someone is needing substance use disorder care, there is care available. We talked about the virtual pathway, but there is still help available if somebody needs it.
Well, Dr. Lanzisera and Dr. Bulat, I want to thank you very much for your insight today. It's a very informative discussion.
Thank you.
And before we sign off, folks, for For more information about our mental health services, you can go to henryford.com/behavioral health. A couple of reminders. We've talked about this previously on our Facebook Lives, the White Ribbon Project. You know, we don't want you going to the local craft store to be finding your craft materials. You can get creative at home and go from there. But you can also find a template on our website, henryford.com. And certainly any questions related to the COVID pandemic, you can call our hotline at 313-874-1055. That line is available from 8 a.m. to 5 p.m. So with that, we will conclude today's Facebook Live. And again, thank you, Dr. Lanzisera and Dr. Bulat.
Have a nice day.
Everybody stay safe out there and maintain your social distancing. Thanks very much, and we'll talk to you later. Bye-bye.
Bye now.